Hey, beautiful. Welcome back to another episode. It is your girl, Nurse Drippiana, coming at you with the real talk that you need. I'm your no fluff, tell it like it is, licensed nurse who's here to make preparing for surgery so much easier. With love, of course. I'm literally buzzing with excitement today because we're talking about something that's going to change the game for your recovery. Everything we talk about here at Inside the Dollhouse is going to change the game for your recovery. So don't stop tuning in, subscribe, because if you're considering plastic surgery, or maybe you've already booked your procedure, you've probably heard about compression garments, right? Or as many of us lovingly call them, fajas. And maybe you're thinking, okay, it's just a tight clothing. I know I need to wear it. I wake up from surgery in it. This is just what we have to do. How important can it really be? Oh, honey, let me tell you, your compression garment is doing so much more work than you realize. It's literally your recovery bestie, aside from me, of course. It is working 24/7 to help you heal beautifully and get the results you are dreaming of. Today, we are breaking down exactly what's happening underneath that garment, why it matters more than you think, and how to make this part of your journey as smooth and successful as possible. Because knowledge is power, and that's what we provide you here. When you understand your why, everything becomes much easier. It's just a smooth ride. So grab your favorite drink, get cozy, and let's chat about why your faja deserves way more credit than it gets. And babe, if you want to take notes or need specific product recommendations, I've got you covered. I've created a comprehensive supply list for every type of procedure on my website. Everything from exact fajas I recommend to recovery essentials you'll actually need. These aren't just random suggestions, honey. They're the products I've personally vetted and that my clients swear by. So go ahead to the Dollhouse HQ and check out our supply section. Let's get down to the meat and potatoes, why we are here. Let's start with the science behind compression. Okay, let me break it down for you because this is where the magic happens. Picture this. You just had your procedure, your surgeon did their thing, and your body is like, whoa, what the hell just happened? Like, your body immediately kicks into repair mode, which is absolutely incredible. But it also means you've got a lot of swelling. You've got fluid trying to figure out where to go, and tissues that are basically like, we need some guidance here. Please help. This is where your faja becomes your absolute best friend. Think of it as your personal body coach, not bossy, but supportive. It's literally hugging you in all the right places, guiding everything back into place as you heal. And honey, what it's doing for you around the clock? Let me break that down real quick. It's managing fluid. So first up, let's talk about why your body is literally creating its own little swimming pool after surgery. I know it sounds gross, but it's totally normal. And when you have a procedure, your body goes into protective mode and starts producing extra fluid to cushion and protect the surgical area. Think of it like your body's way of saying, I got you, babe. It's going to take care of things, right? But here's where it gets tricky. Without your faja keeping things in check, that fluid is going to hang out wherever it wants. And trust me, you don't want it setting up camp in places that are gonna make your results look lumpy, make them look uneven. Your compression garment is like that friend who gently guides the party guests to where they need to be instead of letting them trash your house. Many of you have taken off that faja in the first few days for your massage and you are feeling lightheaded. This is why. There's free fluid just flowing around, making you feel crazy. And the minute you put that faja back on, you're like, ooh, what a relief, and you feel safe. Think about that. Another thing a faja does is provides tissue support and contouring. Now, here's where things get really cool. Your faja is basically your personal sculptor while you sleep. Think about it. Your skin and tissues just went through a major change, and they're trying to figure out their new shape. Without proper support, they might heal in ways that aren't exactly what you had in mind. I know you've seen that too, people reporting that their body is just not shaping up the way they thought it would. And if you dive deeper with those people and ask the proper questions, you realize that they didn't take the faja and the compression action seriously. Your compression garment is like having a gentle, consistent hand guiding everything into place. It's like helping your skin stick to the new contours. It's supporting your tissues as they form new connections and basically ensuring everything heals in the beautiful shape you and your surgeon worked so hard to create and that you just paid thousands of dollars for. It's literally sculpting your dream body while you heal. How amazing is that? Another thing FAJA does is it helps to improve circulation and speeds up healing. This last part here, it's gonna blow your mind because it's like having your own personal blood circulation coach as well. Your FAJA isn't just sitting there looking cute, it's actually helping your blood flow better, which is a huge, huge benefit for healing. Think about it like this. When blood gets sluggish and starts to pool in certain areas, you know that's not doing your recovery any favors. You ever heard of seromas and fibrosis? These are issues that show up post-op because of malfitting or ill-fitting fajas, diminished, decreased, or non-existent lymphatic drainage massage, decreased hydration, and poor assessment of how your recovery is actually going, not knowing what is good from what is not so good. But with proper compression, your blood flow stays nice and steady, delivering all those healing nutrients exactly where your body needs them most, especially if you're getting an IV. If you're getting IV hydration and vitamin therapy, that compression is sending all of that good blood to all the places that need support. It's like having a personal delivery service, making sure all the good stuff gets to your healing tissue on time, every time. Plus, it helps prevent any scary complications. And those are what people don't want to deal with. You, as the client, but also as the post-op care provider, you do not want to see your client in crisis. So let's do all the right things, so that we can stay safe and alive. Your FAJA is literally optimizing your entire healing process, if you can imagine that. Why your compliance and your desire to stay the course and follow the post-op instructions really matters. Compliance is so important, and I get it. Wearing a compression garment 24/7 isn't exactly comfortable or convenient. I get it. You might be tempted to skip it for a few hours or thinking just one day won't matter. But here's the thing, love. Consistency is everything when it comes to compression therapy. Consistency is everything when it comes to everything. If we want to be better and get great at things, we better be consistent. Your body is healing continuously, not just when it's convenient. Taking breaks from compression can actually set back your progress, just like getting dehydrated, lacking proper nutrition or adequate intake in those first 3 days. Everything needs to be followed to a T to support your healing. The domino effect that can occur when you skip compression, even for a few hours. Did you know that fluid can start accumulating again? Like eliminating your progress? Swelling can increase and your tissues might not settle as evenly. It's like taking 2 steps forward and 1 step back. I've seen people who were inconsistent with their compression ended up with prolonged swelling, uneven contouring, or results that took too much longer to settle, and nobody wants that after investing in themselves. Here's what I really want you to know. It does get easier. The first week or two might feel challenging, but your body adapts. I promise. If you're taking good care of yourself, doing all the right things, your body will catch up and do all the things it needs to bring you back to your healed self. Looking a little different, but healed nonetheless. Most of my clients tell me that after about 10 days, they actually feel weird without their compression garment, like it becomes a part of them. And that's a great sign because it means your body is responding well to the support and you're developing healthy habits that will serve your recovery. The quality of your FAJA matters. Amazon $19.99 FAJAs are going to give you $19.99 Amazon FAJA results, okay? It is very important to invest in quality compression garments. It matters so much. A well-fitted, high-quality FAJA will be more comfortable, more effective, and more compliance will come from it. It will make you want to wear it because it's not providing you any discomfort, right? It's not buying a FAJA and choosing a FAJA, paying for a FAJA is an investment in the FAJA, which is an investment in yourself. This is not the place to cut corners. We don't want to cut corners in our recovery journey at all, do we? Now, honey, I want to be totally transparent with you. I've partnered with some amazing companies that I genuinely love and have used myself along with my clients. Snatch Body Fajas and Feelin' Girl Shapewear are two brands I personally recommend to my clients because they consistently deliver quality, comfort, and results. I'm an affiliate with both companies, which means I do earn a small commission if you purchase through my links, but I only partner with brands that I truly believe in. Your results matter more to me than any commission, though. Just want to be clear on that. How do you maximize your results? Let's talk about how to get the absolute most out of your compression garment experience. Because when you do this right, the difference in your results can be truly remarkable. Proper fit is everything. Proper fit is non-negotiable. Your compression garment should be snug, but not cutting off circulation. You should be able to slide one finger at least under the fabric. It should not be loosed anywhere. If it's too tight, it can also impede your healing. It will not promote healing, while too loose won't give you the benefits you need. So another thing you need to remember is that your size might change during recovery. I know you've heard the stage 1, stage 2. Trust the process. As it stops fitting, you go ahead and you course correct and you adjust and you start on your stage 2 faja. If the fit starts to get off after a few days, few weeks, get it refitted if needed. These are an investment and they are not cheap. Unless you're buying them from Amazon for $19.99, then you can buy as many as you'd like. But typically a faja is anywhere between $75, $85 to $150. Could be more. So you want to take care of it and you want to make sure that it's a good one because you're going to be washing it often and you need to wear it every day. So let's just do the right thing from the beginning. One huge benefit and difference that I've noticed is layering and providing some type of comfort with the faja. Wearing a camisole or something cotton, light, thin under your compression garment, this helps with comfort and it also prevents skin irritation. Having backup garments is essential. If you can have one, perfect. If you can have two, even better. You need to be able to wash them regularly, and having options just makes compliance and sticking with the process so much easier. Remember when you are putting on your faja or after your shower that you fully dry yourself. You do not want to put on a faja or an undergarment under the faja with wet skin. That is how we lead to infection. That's how we lead to odor. And that's how we lead to skin breakdown. We don't want any of that. So fully dry yourself before you put on your faja. Timelines. This topic is very popular. How long do I need to wear my faja? I don't like wearing my faja. Can I just wear my faja at night? I don't want to wear it in the daytime. I'm 6 months and still wearing my faja. Let's get it right. Because understanding what to expect helps so much with motivation. Having a deadline, a goal, knowing where we're going, knowing your why makes this journey so much easier. Most procedures require about 6 to 8 weeks of full-time compression, then potentially part-time for several more weeks. But here's what's so beautiful about this process. You'll see improvements by week 1, then a week 2. You'll notice swelling starting to reduce by week 4. You're seeing more definition, and by the end of your compression period, your results are really starting to shine. Some additional things that can enhance your compression therapy would be the lymphatic drainage massage, which you're very familiar with, I hope. And if not, we have a YouTube video explaining exactly what that is and why it's very important after certain procedures. Staying hydrated, eating anti-inflammatory foods, as well as gentle movement as approved by your surgeon. You always want to follow your surgeon's post-op protocol to stay in their guidelines for proper support. That's typically what you want to follow. What you're hearing with me is a broad guideline. This is by no means medical advice. This is just my experience and information that I think will be very, very powerful and useful for you as you go into your surgery journey. Don't ever forget that your compression garment is working with your body's natural healing process. So when you support it properly with all the things, your body can do its most beautiful work. You know I love to bust a good myth, so I have a few for you because why not? Tighter is not always better. No, you can't just use shapewear instead, what you were using before surgery to wear that nice little bodycon dress. We're not doing that. And you cannot skip it on weekends. You cannot give your body a break right now. If you give your body a break from healing, your healing is delayed. We end up with issues, seromas, fibrosis, hard spots, soft, fluid filled spots. We don't want no problems. It always sets your progress back. What I want you to do, though, is I want you to trust the process. I want you to trust your surgeon's guidance. And I want you to trust that every day you're consistent is a day you're closer to your dreams. I also want you to trust that Inside the Dollhouse will be here to support you every step of the way. Your stages of your FAJAs, the timelines, critical do's and don'ts, that is what we're here for, to provide you everything you need so that you can be the best you can be during this time. All right, babe. Now we're really getting into the juicy stuff, the expert level information that's going to make you feel like a total FAJA pro. This is where my years of nursing experience and working with post-op patients is going to absolutely change your game. So grab a pen because you're going to want to take notes on this. The 3-stage system, your complete roadmap. Okay, let me break it down. 3-stage system that medical professionals use and why each stage is absolutely critical for your results. This isn't just made up marketing stuff. This is a real medical protocol that can make or break your outcome. The critical foundation. That is the stage 1, right? That is 0 to 2 weeks. This is your ride or die phase. Stage 1 garments provide maximum compression. We're talking 30 to 40 millimeters of mercury of pressure, which is serious business. You wear this baby 24/7, and I mean 24/7, maybe 24/6 and 7/8, because you have to take that massage in that shower. Only remove it to shower and massage. And even then, you need to get it back on ASAP. This stage is all about managing that initial drainage, that surgical fluid that your surgeon used during the procedure. It's called tumescent fluid. They add fluid during your procedure so your body doesn't drain and lose all of its goodies. So during this phase, your body is literally draining excess fluid through those little drainage tubes or those little incisions, and your compression garment is helping to squeeze that fluid out like a gentle, consistent hug, right? The more fluid that drains properly, the less bruising and swelling you have. And this is not the time to slack off, love. This phase is literally what sets the foundation for everything that comes after. Stage 2, the healing and adherence. That's 2 to 8 weeks. Once your drainage slows down and those tubes come out, you're transitioned to stage 2. And honey, this phase is where the real magic happens. Your compression drops to about 20 to 30 millimeters of mercury, which is still firm but more comfortable. This stage is all about helping your skin adhere to new contours and supporting proper tissue healing. Stage 2 garments often have additional inner panels and different closure systems. Maybe a closed crotch instead of an open crotch and a different zipper placement. You're still wearing this most of the time, but your body is getting used to its new shape. This phase can last anywhere from 2 to 8 weeks, depending on your procedure and how you're healing, how well you're taking care of yourself, right? So then you have the stage 3. That is maintenance, and this is where we start to approach our perfection phase. This is 8 weeks plus. Stage 3 is where you transition into maintenance mode. This is more like high quality shapewear with lighter compression, around 15 to 25 millimeters of mercury. You might wear this during the day for a special occasion, but it's not the intensive medical compression of the earlier stages. This is about maintaining your results and supporting your body as it fully settles into its new shape. I would be remiss if I didn't share with you some critical do's and don'ts, the make or break it rules. These are things that we need to be mindful of, and these aren't suggestions. These are rules that separate amazing results from disappointing ones. And I've seen too many beautiful people sabotage their own results by not following these guidelines. The non-negotiable do's. Do measure yourself properly. And honey, I mean measure with the swelling. Your post-surgery measurements are different from your pre-surgery ones. Do invest in at least 2 to 3 quality garments so that you can wash and rotate them. Do check your skin daily for pressure sores, redness, or irritation. Do follow the 24/7 rule during stage 1, no exceptions for date nights or special events. And do choose breathable medical grade materials. We're talking moisture wicking fabrics that won't trap bacteria because you're healing skin. Do Listen to your surgeon's specific timeline because every procedure and every body is different, which is something that I doubt people truly understand. And do thoroughly dry your body before you apply your FAJA. This is how we don't get the bacteria. This is how we don't get the skin breakdown. This is how we don't get the smells. This is how we thrive, okay? How about the absolute don'ts? Don't try to use regular Spanx or shapewear instead of medical grade compression because, honey, that's like using a Band-Aid for a broken bone. Don't go tighter thinking more compression equals better results. Too tight can actually impede circulation and delay healing. Don't skip days thinking just one day won't matter because it absolutely will. Don't ignore warning signs like numbness, tingling, persistent pain, or skin irritation. And please, 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 don't try to rush the process by moving to the next stage too early. Each stage has a purpose. Trust the process. I have seen the mistakes that cost people thousands of dollars in revision procedures and months of adding additional healing time. Let's make sure you don't become one of these statistics, okay? Because that's not what we're here for. We're here to thrive and not just survive. So mistake number one that I've seen is the wrong sizing. Either it's too tight or too loose. We discussed this before. Too tight can cause nerve damage, circulation problems, and permanent skin indentations. I've seen the complaints. I've seen the pictures. It's wild. Just buy the right size garment, okay? Too loose gives you zero benefit and can lead to uneven results, prolonged swelling, fluid accumulation, and a waste of damn money. Properly measure and get the proper size FAJA. Mistake number two, inconsistent wear. Honey, wearing your garment just at night or only in the daytime is not going to cut it. Gaps in compression allow swelling to return and can cause irregular healing patterns. I've said it before, I'm going to say it again. I've seen people with lumpy, uneven results because they just weren't consistent. Mistake number three, poor hygiene. If you had poor hygiene before your surgery, don't think that it's going to change afterwards. Hygiene is so important. It prevents skin infections, rashes, bacterial buildup. If you're getting that BBL and you've heard people complain about that BBL smell, that's why the BBLs tend to have a smell, because the poor hygiene did not come with the person, which was not delivered at surgery. And you ladies who are not adequately washing and cleaning and doing the things that you need to do on a regular basis, let's get it together. Let's get it together. All right. Now, let me break down the specific timelines by procedure because not all surgeries are created equal. And before we dive in, if you want super specific garment recommendations for your exact procedure, definitely check out Dollhouse HQ. We have incredible procedure-specific guides and recommendations that complement everything I'm about to tell you. All right. So I know we've spoken about FAJAs, which is typically after Lipo 360, BBL, tummy tucks, and things like that. But for my breast augmentation beauties, let's talk about your compression bra journey. Immediately post-op, you're going into a surgical compression bra with about 15 to 25 millimeters of mercury of gentle but consistent compression. This isn't your cute Victoria's Secret bra. This is a medical grade support that's working 24/7 for the first 2 weeks to minimize swelling and support your healing tissues. Week 2 to 6 is your transition time where you can go to a high quality sports bra with good support, but absolutely no underwire during this phase. That wire can press against your healing tissues and cause serious problems. Your surgeon will give you the green light for underwire bras, usually around 6 to 8 weeks, but some prefer to wait until 3 months. And sizing is tricky during this phase because swelling changes everything. You might need to size up initially and adjust as swelling goes down. And then those beautiful, beautiful compression socks. You didn't think I was going to leave that out, did you? Those are your deep vein thrombosis prevention heroes. Now let's talk about something that absolutely is critical but often overlooked: compression socks. Every single surgical patient should be thinking about DVT prevention. And honey, these just aren't for your grandma. We're talking about preventing blood clots that can literally be life-threatening. For surgery prevention, You want 15 to 20 millimeters of mercury, graduated compression socks starting the day of surgery and continuing for 2 to 4 weeks depending on your procedure and mobility level. You will wake up in a FAJA. If you had breast aug, you will wake up in a bra. And if everybody's going to wake up in compression socks, that's just what it is. If you're having longer procedures like BBL or extended lipo, if you have risk factors like a history of clots or birth control use, your doctor might recommend 20 to 30 millimeters of mercury for up to about 6 weeks, just as a extra layer of caution. The key is graduated compression though, babe. Tighter at the ankle and gradually decreasing up the leg. This helps push back the blood up to your heart instead of pulling at your lower legs. You wear them during the day, and your surgeon might want you to sleep in them for the first few nights post-op, so don't be alarmed or don't be surprised if that request is asked of you. Just do it. Trust me, because a little leg compression is way better than dealing with a blood clot, 911, emergency room, and all the things, the other not so good things that come with blood clots. So, my beautiful, beautiful dollhouse darlings, I think I like that name. I would love feedback to see if we're all in agreement or some suggestions about our little tribe that we're growing here. I hope this episode has given you a whole new appreciation for that compression garment. It really is not just a piece of fabric. It's your recovery partner. It's working tirelessly to help you achieve the results you've dreamed for, invested in, and have paid for, and you will not get your money back if the results do not result. We know this. You just got to pay more money to go get it fixed. So let's do all the right things from the beginning. Let's trust the process and do it properly. Your journey to feeling confident and beautiful in your own skin is oh so valid. And every step you take to support your healing process is an act of love, and I see you. That includes wearing your FAJA consistently, even when it feels like a hassle. Remember, the temporary discomfort of compression therapy leads to long-term benefits that you'll enjoy for years to come. Every day you stay consistent is an investment in your future self. If you're in the planning stages of your procedure, use this information to prepare mentally and practically. Invest in your quality compression garments, plan for the adjustment period, and set yourself up for success. If you're currently in recovery, I'm so proud of you for taking this journey and prioritizing your healing. You're doing amazing. I'm telling you that right now. You're doing amazing, even on the days that you don't feel like it. Your compression garment is doing incredible work behind the scenes, and I know you are too. You're supporting your healing. The FAJA is shaping your results and helping you become the version of yourself you've envisioned. Honor that process, trust it, and know that every day brings you closer to your goals. And now, if you're feeling overwhelmed by all this information, or you want personalized guidance for your specific situation, I'd love to chat with you. I offer glow up game plan calls where we can dive deep into your goals, timeline, and create a customized plan that's perfect for your journey. These calls are so valuable for getting clarity and confidence about your path forward. And remember, all those supply lists I mentioned, they're waiting for you on my website, along with tons of other resources to support your entire journey. Don't try to figure this out alone, love. I've done the research so you don't have to. Thank you so much for spending this time with me today. If this episode helped you to understand your recovery journey a little bit better, please share it with someone else who might benefit. We're all in this together, supporting each other towards our best life. And until next time, keep loving yourself through every stage of your journey and FAJAs. You're worth the investment, you're worth the care, and you're going to absolutely love your results. If you stick with the plan and prepare with intention, you know I'm here to help you thrive, not just survive. This is Nurse Drippiana, signing out with love, light, and peace until I see you again. Thank you so much.